And to all, I'm Dr. Sathiswaran, who is practicing diabetologist and diabet for the past 20 years. Today, our discussion will be on high blood pressure and how to prevent it. In addition to diabetics, it is one of the stigma. It is one of the most prevalent cases that goes undetected. So generally, everyone would like to have a healthy or normal blood pressure, but what does it mean? What is normal blood pressure and what is this high blood pressure? Normal blood pressure, as we say that it should be around the average is around 120 by 80. Okay. Basically, each time when the heart beats, how the blood pressure has been recorded. Heart it pumps blood and the blood vessels so into the blood vessels. This creates the pressure and against the blood, also the blood vessels, and this is called this the blood pressure. Normally, in a healthy person, it rises and falls throughout the day. There is a nocturnal variation and depends on the day and it depends on the work what we are doing it and the nature of work and the nature of our mental at the time what we think, what's our how we deal with the situation, that everything that matters. When blood pressure remains high for a longer time and left untreated, it can lead to very serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. So high blood pressure usually develops over time. It can happen because of an unhealthy lifestyle, like sedentary lifestyle, no exercises, junk foods, intake of more oily food, salt intake, and smoking and alcohol consumption and stress. There are there are other factors that can also increase the risk of developing hypertension, such as what are this? As the age, as the age process, the elasticity of the arteries are gone, so the arteries become stiffened and narrow, and in excess of as excess fat builds up because of the old age process and the family history of blood pressure. One or more close related family pressure with hypertension increases the person's risk of developing the condition. Salt intake and not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating increased amounts of fatty tissues and uh, the processed foods, there's the fast foods, and which is quite common each and everyone. On the other hand, the lack of physical activity because of our workload. We usually they say we don't have time to go work, and we are getting occupied in our work. So these are the factors that result in hypertension. In addition to this, is stress. Stress is stress that might be either it is physical or mental, either it could be at home or at the work pressure, everything that leads to hypertension. Moving on, hypertension does not have any obvious signs and symptoms. The, the can even if you check a normal person who doesn't have any symptoms, just who is getting in accompanying his relatives to the clinic, he might have an high blood pressure. But the person who complains of giddiness, headache, sweating, uh, or who comes for who thinks that he might have hypertension, he might be perfectly normal. So that's why we say it as a silent killer. It is also along with diabetes. Diabetes is also one of the silent killer. So it's because of this, the silent killer. It's because it doesn't shows any signs and symptoms. By the time when we detect them, it may be detecting usually casual when they come for a checkup or going for a hospital checkup only it will be detected. By the time most of the people might develop certain complications in the organs of such as heart and kidney. Maybe CKD is the one of the in some persons it is only the identifying the problem itself. At the time of identification itself, the patient might have chronic kidney disease. Hence, early and accurate diagnosis is very important in documentation of hypertension as well. Generally, when symptoms do occur, they include morning headaches or tiredness, like I said, vision changes, like a blurring of visions or nausea, vomiting. but only around 50 to 60 or 60 to 70% only will be presenting in that. Rest of the person doesn't have anything. Yeah, they don't have any signs and symptoms. Or fortunate high blood pressure can be easily diagnosed, but it is often not done. It is usually measured with an instrument called as pygmo, that is a BP machine. The blood pressure is recorded in two numbers: is systolic and the diastolic. Systolic is the upper limit and diastolic is the lower limit. Now let's try and understand what to do. That actually the numbers means. The healthy normal pressure, as I showed, is it's around 120 by 80 millimeter of mercury. The upper number indicates the systolic pressure, which means the pressure in the blood vessels when the heart contracts, whereas the lower, that is the denominator, that is the diastolic blood pressure, when the heart relaxes. So, what is the risk between the beats? Which means the pressure in the blood vessels between this. If blood pressure is more than 144/90, then we say the person has, we say, has hypertension. The risk can be prevented and reduced by taking certain steps. How can it be reduced, or how can the risk can be prevented? Just like regular exercises, healthy diet, and quit smoking, and reduce alcohol intake, and regular blood pressure monitoring, and stress management, and adherence to the medicine, those who are on medicines. If the blood pressure is usually successfully controlled with lifestyle modification, then it might avoid or delay or reduce the need for medications. The first is the lifestyle modification, which we normally deny or we neglect, stating that we are busy and we don't have time to do the job, to work physical activities, we don't do it. And we will take it as the easiest way is consuming a tablet instead of going to physical activity. But taking a tablet instead, once if you don't try physical activity, you will end up in taking tablets that will control the blood pressure. But even taking medication, lifestyle modification, that is walking and reducing the body weight, that is also like a medication only. And what are the regular physics? At least 30 minutes per day, at least for 5 to 6 days a week, 5 days a week. Healthy diet, and the healthy diet also that is a huge intake of vegetables, fruits, and whole grains, and for avoid high fatty diets and everything. So one can adapt a dietary pattern such as DASH diet. DASH diet is this dietary appropriates approaches to stop hypertension and eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in the diet and limiting alcohol consumption. So what is the DASH stands for? That is already I said it is a dietary approaches to stop hypertension diet that is rich in whole grain, fruits, vegetables, and low fat diet produces products and saturated fat and cholesterol can lower one's blood pressure. So avoid oily stuffs and reduce sodium into your diet. That is normal. So take off of the sodium. That is a that might reduce. That will reduce if you take off the salt per day. The recommended dosage of sodium, it will reduce to 5 to 6 millimeter of mercury. So that way that you can prevent the complications, late complications also. If like if you avoid processed food and don't add salt, just don't add added salt, and quit smoking. If you are a smoker, avoid smoking, and regular blood pressure monitoring is a must. Taking a tablet since it doesn't produces any signs and symptoms. So if you are taking a tablet, the only thing that allows you to know that you are on regular that your BP figure under control is only taking BP monitoring. If you're not monitoring, you might think that you are absolutely normal, but in reality, it is not so. So that's why it has been said as a sign killer. And only thing is, once if you develop a KD or a cardiac problem, then it is one way. We can't come back. So that can be prevented if you closely monitor your sugar, BP, not it, not only the taking of diet or taking a further diet control or BP tablets, it's not sufficient. But you have to measure BP so that either it will help us to understand, allow the doctor to decide either to increase the dosage of the medication or reduce the dosage of the medication or just to allow you on only on lifestyle modification. Is it enough to go on lifestyle modification, or you have to be on a single drug or double drug or a triple drug? In addition to this, the stress management, which we often neglect. Often we say that we are not stressed, but it is also a silent one, which you deny that you are not stressed. But each and everything that matters. If you go out, if you are driving a vehicle, suppose someone crosses inside between, and then if you shouts at him, and you'll be thinking about for another 5 to 10 minutes, that causes a mild stress on your body. That releases in the cortisol, the hormones that has been secreted in the body, and then subsequently the pumps, it increases the heart rate, and then it increases the blood vessels, the density of the blood vessels, and you are land up with again high blood pressure and adherence to medication. Adherence to medication is thinking that we are normal. No, on the outset, you might be normal. You might think that you are normal, but it can be said only because of medication. But if the doctor says after you are on medication that you are normal, it is because of taking the medication and not because of only lifestyle. If lifestyle is sufficient, the doctor will say, the treating physician will say to you that you continue the lifestyle modification and not to take medicines. It doesn't mean that you can take anything you want. If you're taking anything, again you will land up in problem. Again you will have the pressure will increase, and you will lead to comorbid conditions like heart attack. You might land up with cardiovascular problems or a kidney disease. At least I like to suggest that there is nothing more precious than having a fit and healthy life. Adapting to healthy life first is to enjoy long and healthy life. And pleasure can be prevented with control in many ways. One is lifestyle modification, stress management, medication, and keeping your blood pressure in the normal range is very important. I hope, I think, and I had clarified most of your doubts and most of the things. Thank you.